Good day, folks. Thank you for joining us here at Your Health. On today's program, we want to talk about the remarkable health benefits of taking probiotics as a dietary supplement. You know, these living organisms that reside in our intestinal tract play a vital role in good health and the prevention of disease. Also, we should think of probiotics as an agent to help you come out of disease, let your body nutritionally repair itself. And these probiotics do amazing things. We have some new research to share with you today. But first, let's go to the news. Let's see what's happening in the health world. America's diet has improved. Researchers from Tufts University compared dietary data from the National Health and Nutrition Examination Surveys conducted over the 13-year span from 1999 to 2012. They found overall the diet of a typical American has improved with increased consumption of whole grains, nuts and seeds, whole fruits, and seafood. They also found Americans are consuming less sugar and high fructose corn syrup sweetened soda and fruit-flavored beverages. Over the time span of the study, the percentage of Americans that consumed a poor diet declined from 56% to 46%, a relative drop of 18%. The study was published by JAMA. Related research also from Tufts University, a meta-analysis of 19 previous studies involving over 45,000 subjects finds those who consume the most seafood and omega-3 fatty acids are at 10% reduced risk of having fatal heart disease. And finally, from Monash University, researchers find from an animal model, diets high in fiber and vitamin A reduce the risk of developing food allergies. The high-fiber vitamin A-rich diets promote healthy intestinal bacteria growth, which makes the immune system resistant to developing potentially life-threatening food allergies. Well, folks, our first study shows that we Americans are finally paying more attention to what we are eating. Those who consume a poor diet have dropped from a miserable 56% to a significantly improved level of 46%. We should keep in mind, however, there is still much work to be done, as those who consume a near-perfect diet has only increased from a paltry 0.7% to 1.5%. But we are making progress. Our second and third studies show the potential benefits of eating a better diet. Eating more seafood with their omega-3s will lead to less cardiovascular disease, and eating more fiber from fruits and vegetables will lead to a healthier intestinal tract and fewer cases of severe food allergies. This pattern of improved American diet with time will undoubtedly save us billions of dollars and prevent much disease and suffering. Vitamin D helps heart failure patients. Researchers from the University of Leeds evaluated 229 heart failure patients' response to 4,000 international units of vitamin D3 or a placebo over the course of 1 year. They found the heart failure patients that took vitamin D saw an improvement in their heart's ejection fraction from an average of 26% to 34%. They also found those who took vitamin D experienced a reversal of left ventricular remodeling, or said in other words, their hearts no longer continued to enlarge. Folks, heart failure is a major problem for people around the world. Here in the U.S., heart failure is the most expensive disease Medicare pays for. Once diagnosed, lifespan is on average just 5 to 6 years. When heart failure occurs, it means that the heart can no longer compensate with increased performance when extra demands are placed upon it. This means in end-stage heart failure, the heart is working as hard as it can, even when the patient is lying in bed. So to find a simple and cheap measure such as taking a little extra vitamin D leads to an improvement in the heart's ability to efficiently pump blood, well, that's truly a godsend. Also, the researchers found that heart failure patients that took the vitamin experienced a reversal of the heart enlargement trend that is the hallmark feature of heart failure. Now just imagine what we could do for heart failure patients if they took, along with vitamin D, CoQ10, L-carnitine, D-ribose, magnesium, and fish oil, omega-3s. We would most certainly make dramatic improvements in their ability to physically engage life. We have some other new vitamin D research I'd like you to be aware of. First, from the University of Kansas. When mother has a higher blood level of vitamin D during her second trimester of pregnancy, her baby is at greatly reduced risk of asthma. Next, from the Lurie Children's Hospital of Chicago, when mothers are obese or gain too much weight during pregnancy, it reduces their and their baby's blood level of vitamin D, opening the door for unnecessary diseases in baby. Next, from McGill University, when baby has a healthy intake of vitamin D during the first year of life, they develop stronger bones, more muscle, and less fat during their childhood years. And from the University of Leeds, researchers find that when men with prostate cancer go to surgery, and it is then discovered they have a low vitamin D level, they are much more likely to have aggressive, metastatic, life-threatening prostate cancer. And our last vitamin D study results from the University of California at San Diego, researchers find women with vitamin D levels above 40 nanograms are 67% less likely to develop cancer than women with D levels below 20. Well, that's amazing, isn't it? What a benefit from vitamin D. Well, folks, as promised, today on Your Health, we'll discuss the benefits of supplementing probiotics. Please stay tuned to learn more. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at BioInnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker's Bionutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha, Noni, and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let BioInnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Cindy Becker for Your Health at a Glance. We all have said, I need to get some exercise, but how many of us put on our walking shoes and go? Learning a little more about the health benefits of exercise may help you get motivated to lace up those walking shoes. Exercise helps to control our appetite and weight. It maintains strong muscles. It promotes the release of endorphins that counter depression while helping us feel good about our lives. Exercise helps to lower blood glucose, promotes a strong circulatory system, and controls cholesterol. Exercise even helps us get a good night's sleep. Recent research finds dog owners who regularly walk their pet are 34% more likely to achieve fitness goals. You can get all of these health benefits by walking 30 minutes 4 times a week, just 30 minutes a day. Start today, and you'll start to get all those benefits. For Your Health at a Glance, I'm Cindy Becker. Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastrodefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
Welcome back, everyone. It is such a blessing to be with you today. And I've got to tell you, I hope everything is going wonderful in your corner of the world. And don't you just love this time of year? I do. The air starts getting crisper. The leaves are changing just a little bit. I just love this time of year. In Texas, it's still hot, though. But I know that a fire is coming soon. So, you know, I just love it when I get that time of year. I think it's probably, Richard, because my birthday's in the fall. Maybe that's why I've always just loved the fall.
And Thanksgiving's coming.
Christmas is coming, and all of that. I know.
All the good things.
Well, we have a great show planned for you today. We're going to be learning all about intestinal health. And as you know, Richard has done this topic quite a few times on the show. But each time he brings out more research, more news, and we learn more about how important it is that really, you've got to really step back and say, good health begins and ends in the intestines. You know, Richard, when
Yes.
you started doing this topic a few years back, there was just a handful of studies.
Boy, isn't that the truth? 30, maybe 35 on probiotics at the National Institutes of Health. Now there are thousands from all over the world. And what we're learning, folks, is that our intestinal bacteria play a complex role, and they are made up of a complex ecosystem. It's a life form in and of itself. And to help you understand that, in order to understand the role of probiotics, we have to understand the role of our intestinal flora. So let's start with that. Intestinal bacteria, a complex living ecosystem. A recent study was published in the scientific journal Nature. Scientists from 7 countries mapped out the genetic composition of 124 healthy test subjects' intestinal tract bacteria. They found that there are 100 times more microbial genes than human genes. They are now calling the microbial genetic composition the second genome. The first genome is us, complete genetic makeup. The second genome lies in our intestinal tract, and it has 100 times more microbial DNA than human DNA. Isn't that amazing? There are 10 times the number of bacteria in our intestinal tract than all the human cells combined. It makes you wonder who's in charge of who. Are we really in charge? Well, of course we are, but you know, they outnumber us 10 to 1. There are about 160 different bacteria species on average in the typical human adult. And that was a little less diverse than they thought it would be. There are estimates all the way up to 2,000-3,000 different species. 160 is the typical. Life's events have a profound effect on intestinal bacteria. This is one of the main reasons why people get stuck in poor health, is that their intestinal flora changes. And to give you scientific evidence as to that effect, University of British Columbia analyzed the chemical composition of mice feces. Not a glamorous job, but very important. They looked at 2,000 different chemicals. They re-examined the feces after 1 round of antibiotics. What happens to the gut flora in an animal after 1 round of antibiotics? They found 1,750 of the 2,000 different chemicals increased or decreased from 2 to 10,000 fold. The most affected were the hormone systems, the inflammatory system, carbohydrate and fat metabolism, along with bile production and recycling of blood components. These are fundamental, life-driving metabolic processes in our body. The hormonal system, our hormones affect everything. Every cell has a hormone receptor of some type on it. The inflammatory systems, you heard all over, you ache, the arthritis, the headaches, the neck pain. You know, you're in a motor vehicle accident 10 years ago and you're still suffering in pain, you're inflamed. It also drives cardiovascular disease, our #1 killer. And our #2 killer, cancer, is also driven by chronic inflammation. Change the gut flora, this is what happens to you. Carbohydrate and fat metabolism. We all know that high carbohydrate levels in the bloodstream means you are diabetic, and if we get too much fat in our bloodstream, it puts you at risk for heart disease. Bile production and recycling of blood components. This is how we detoxify. With the recycling of the blood components and the shedding of the bile through the system, not only does it help to digest our foods, but it also traps the toxins and poisons that our livers have excreted to be taken out of our system and eliminated. You affect these systems, you're going to be in trouble. And just 1 round of antibiotics affect every one of these systems and more. Next, University of Pennsylvania found long-term diet dictates intestinal flora bacteria types. And now they are calling these enterotypes. Entero means intestinal tract, small intestine, and enterotype of bacteria. We find that if you eat a high-fat and meat-based diet, you are now what they call Bacteroides dominant intestinal flora. If you have a carbohydrate, high-fiber diet, it is the Provitella bacterial enterotype bacteria type in your intestinal tract. There's a third type, the Ruminococcus. They're not quite sure what leads to that, but they're working on it. The point being, your diet dictates your bowel flora. That's the point of this. Next, University of Maryland. They found probiotics, these are the good guys, these are the ones we're talking about today, facilitate the actions of the enterotype intestinal bacteria. So think of the probiotic as the symphony conductor, telling the strings to do what they do. You can imagine this. The probiotics dictate the patterns, the activities of the other bacteria in the intestinal tract. They act as a conductor of a wide variety of actions, even those arising from non-probiotic intestinal bacteria hosts. They tell the other bacteria how to conduct themselves. If you don't have these probiotics in your diet and your supplement plan, the orchestra plays out of tune. Think of it that way. Next, how do we disturb this gut flora of ours, our ecosystem, our enterotypes, the bowel bacteria? What leads to problems? Modern living leads to intestinal dysbiosis, altered levels of intestinal bacteria. You may have overgrowth of one, overgrowth of many, suppressed counts of normal. It's just dysbiotic. It's out of kilter. A condition of abnormal intestinal microbe growth creating toxic and carcinogenic substances. Dysbiosis leads to disturbed digestion, disturbed malabsorption, inflammation, suppressed immune function. Intestinal dysbiosis leads to a hypervigilant immune system. This means you are susceptible to autoimmune disease, such as thyroid disease, lupus, rheumatoid arthritis. There's some 70, 80 of these autoimmune diseases, and dysbiosis leads to this. Altered cholesterol-based hormones. It affects your hormone systems when you're dysbiotic. This can lead to cardiovascular disease and hormone-driven cancers. Altered mineral and electrolyte levels, altered mineral absorption and use of minerals. What can that lead to? A wide variety of things, including cardiovascular disease and osteoporosis, disturbed carbohydrate metabolism, diabetes, altered recycling of blood products. This is your bile and digestive process, and toxic elimination. All of these things can happen when our bowel flora is off. Now, how would you know if you have signs of intestinal dysbiosis? You may have infections, one after another. You can have bacterial, virus, or chronic fungi. Yeast infections, this type of thing. Fungal skin infections. We'll see an increase of allergies. You had allergies as a kid. You were over them. Now in your 40s, all of a sudden you have hay fever again. That's dysbiosis. That's chronic sinus from antibiotics and the associated change in bowel flora. You may have weight gain or weight loss. Usually when people are in a chronic state of poor health, they tend to lose weight. That's what we think of. But with dysbiosis, we gain weight. And what's the American population doing? It's gaining weight. Dysbiosis is widely prevalent. There may be constipation, back and forth with diarrhea, irritable bowel syndrome, gas, food intolerances, lactose intolerance, fatigue with insomnia, tired all day, can't sleep at night. What a syndrome. This is so common to see. Chronic fatigue syndrome, fatigue all day, but you can't sleep well at night. Headaches, body pain. Dysbiosis leads to chronic inflammation, which leads to body pain. Autoimmune diseases, metabolic syndrome, which is an elevated blood glucose, not quite to the diabetic region. High blood pressure, it's starting to creep up. Triglycerides, there's a little weight gain. Insulin resistance is the pre-diabetic state. This is a common sign of intestinal dysbiosis. You may have a history of disease and multiple doctor interventions with many different medicines and, of course, antibiotics. Who hasn't had a round of antibiotics in today's world? Now, when we return from these important messages, I want to go through one by one the exact causes. We've talked about the signs of dysbiosis. Now let's look at the causes. The whole point of this is to help you to decide, well, he's talking about me. I need to take steps to correct the flora. Causes of intestinal dysbiosis when we return. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at BioInnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker Spa Nutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha, Noni, and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let BioInnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. Do you have a family history of a certain disease? Scientists are discovering that our genetic code plays a smaller role than previously believed. Only about 20% of disease is tied to our innate genetic code. So what determines the other 80%? The answer may lie in the emerging field of epigenetics. What is it? Epigenetics is a group of changing factors responsible for both how our genes are read and how they are then applied throughout the rest of the body. And this may explain why identical twins with identical genes can have different health problems. Researchers believe two of the main factors in epigenetics are nutrition and environmental exposure to toxins. So eat a healthy diet, reduce toxin exposure, and you may improve your own epigenetics. For Your Health at a Glance, I'm Dr. Richard Becker. Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-pack. And remember, it's 50% off by the case.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
We're back, everyone, having a great discussion. We're learning all about healthy bacteria for good intestinal health. So we learned about the signs and symptoms of intestinal dysbiosis. Now let's go into the causes. What really happens to make us end up with this condition? So Richard, what causes this anyway?
Well, one of the most common reasons, widely prevalent, is poor dietary practices. Between 45 and 55% of the Americans have a poor diet. And if American has a poor diet, you know it's pretty bad because of all of our refined, it's sad, it's a standard American diet, refined foods, highly processed, a lot of fat, a lot of sugar, all the bad things, a lot of chemicals. So malnourishment and poor eating habits. In some regions of the country, it's as high as 80% of Americans. No raw foods, refined, low fiber, chemical heavy, heavy metal exposure, all the pesticides that get into these non-organic foods. And this has a profound effect. You can't expect to put poor ingredients in and have, perfect health. You are what you eat, right? So number 1 is malnourishment and poor eating habits. Chlorinated and fluoridated water, 2 of the most damaging substances to intestinal flora. We put chlorine in the municipal water to keep bacterial sepsis out. And it's from sewage contamination. That's what we're trying to keep out. We drink this, and right from the tap, and that chlorine has an effect on our intestinal flora. There's no 2 ways about it. Now, I'm not saying we should get rid of chlorine because we would have thousands of deaths every month from tainted water in this country. But you can let your glass of water sit out for a few minutes because the chlorine's highly volatile. It goes away very quickly. You run it through a activated charcoal filter. There's so many different filtration systems available. You can take that chlorine out and have good tasting water, and it's free of chlorine and fluoride. It can be very helpful for that. Obesity, just the act of gaining weight, the metabolic state of gaining weight leads to altered bowel flora. There's been a lot of research on that due to our diabetes epidemic. Also, diabetes has a distinctly different bowel flora pattern than just obesity. So it's a chain of progression. Obesity, diabetes, both cause a change in bowel flora. Non-alcoholic fatty liver disease. Gaining weight in about 20% of the people, they gain fat in their liver. If left untreated, it can go on to NASH, non-alcoholic steatohepatitis, and if left untreated, it can go on to frank cirrhosis. But it all starts with fat accumulation in the liver. This causes a cascade of events that ends up with altered bowel flora, leaky gut syndrome, and increased toxicity throughout the bloodstream. This is no way to live. It causes disturbed bowel flora. It's another reason. Simple weight gain changes the bowel flora. Antibiotics. One round of antibiotics. There was a study done at University of Michigan that really impressed me when I read this. One course of cephalosporin antibiotics caused intestinal dysbiosis in the human subjects that never corrected itself over the 11-month study. Now, I hope eventually, after 5 years maybe, it would correct itself, but I'm afraid it doesn't. And so many of us, every fall, every winter, every flu season, 2-3 rounds of antibiotics, one cold after another, they're given antibiotics for it. For many, millions of Americans, they never have that prolonged period of time to correct the gut flora. They never take the steps. So if you've had antibiotics at any time in your history, there's a chance that your bowel flora is still disturbed. Do not discount this. This is a profound effect. Antibiotics affect the bowel flora. Pain medicine, anti-inflammatory medication, acid-suppressing drugs, anything that suppresses the acid, anything used to treat GERD, gastroesophageal reflux disease, peptic ulcer disease, anything that alters the ecosystem of the gut will eventually alter the bowel flora. It's inevitable. That's just how it is. Now, we can take steps to correct these things. This is the bad news. We'll get to the good news, but if these things are in your history, please pay attention. We can take steps to fix these things. Foreign hormones, hormone replacement therapies, oral birth control pills, all of these can have an effect on the bowel flora. Steroids, prednisone, allergy sprays. You can get a steroid spray for your nose, allergy spray for your nose, over the counter today. You need a doctor. You could use this every day for the rest of your life, and nobody's paying attention. Nobody's keeping track of that. That can have such a profound effect on your bowel flora. It can suppress your immune system. It can lead to chronic bacterial and fungal infections in your sinuses. You swallow this stuff. It goes down into your intestinal tract and it inhibits the immune system. It allows germs that normally would not grow in your intestinal tract to proliferate because the immune system's being checked. It's being held back. Steroid nasal sprays. Be careful with those sprays. They're fine for a week or 2, 3 weeks in ragweed season and get it under control, but then you're off of them. But don't stay on these things. They can really mess you up systemically. It's also important to follow instructions exactly. Next, stress. Who isn't under stress? Ohio State University, great studies. They showed that Clostridium bacteria increases and Bacteroides decrease by 20 to 25% just from being under stress. So month after month of chronic stress, profound effect. And you know, many people, when they're under stress, they'll become constipated or they get diarrhea under stress. You see that change. And it's a reflection also. It works both ways. The bacterial change can lead to the diarrhea constipation. Diarrhea constipation can lead to the bacterial change. Stress, a major driver of dysbiosis. The simple act of getting older, successful aging, alters our bowel flora. That's been well established in multiple studies. Travel, exposure to new infectious agents, coexisting disease, any ongoing medical condition, especially medications we're using to treat medical conditions, it affects the bowel flora. If you have a weakened immune system, perhaps you went through cancer, chemotherapy, radiation, this type of thing. It affects your immune system. Maybe you're on one of these immune-suppressing drugs to treat your autoimmune disease. This can lead to profound dysbiosis. It needs to be addressed. All of these conditions and more, we don't have time to discuss, can lead to disturbances of normal intestinal flora. What is the answer to all this? Well, we've got to change these risk factors, these driving forces that altered the bowel flora, and then we can make positive inroads here. Now, probiotics mean for life. We also think of them as friendly, good, or beneficial bacteria. Sometimes we need to add these to our dietary supplement regimen because diet is not enough oftentimes. You know, I think of the options people have in a typical grocery store today, Cindy. They go in to get some yogurt, and they see one serving of yogurt has 12 teaspoons of sugar in it. We know sugar drives dysbiosis. We're trying to correct bowel flora with yogurt, which is a great idea, but think of all that sugar we're getting. So sometimes the best way to do this is to just take a dietary supplement and then talk to the grocer and say, I want some sugar-free yogurts, or at least minimal sugar. Is that a reasonable thing to ask for? I think it is.
Absolutely.
You know, I like sweet as much as anybody, but when my options are 12 teaspoons versus 10, that's not really a choice, is it? Well, let's go to our break. When we return, let's talk about the new research on the health benefits of probiotics. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at BioInnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker's Bionutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha, Noni, and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements, because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let BioInnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. Are you tired all the time? Persistent fatigue along with shortness of breath, headaches, and unusual food cravings may all be a sign of anemia. Anyone may develop anemia, but toddlers, women in their reproductive years, and the elderly are most likely to become anemic. If you are diagnosed with anemia, it's important to understand why. Even mild anemia, untreated, can lead to serious illness. Your doctor will diagnose the type of anemia you have, how you develop the condition, and how to treat it. There are many forms. But not all types of anemia are treated with iron. In fact, taking extra iron when it is not needed may add to your health problems. Once you finish treatment, you must follow up with your physician. Anemia can recur. For Your Health at a Glance, I'm Dr. Richard Becker.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastrodefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
We're back, everyone. I've got to let you know we are having a great fall savings celebration at BioInnovations. Wonderful prices and free shipping on orders over $50 in the mainland USA. So don't miss out on it. Get your orders in early so you get the products you want. Isn't this interesting information about probiotics? I find it just fascinating, and every time we study this, I learn a new angle. And I mean, I'm the same as the rest of you. There are times in my life I have to take an antibiotic.
Yes.
I mean, I have to. That's just how it is. So we're going to learn what to do to counteract those effects. So Richard, you've got some amazing information.
Yes.
And new studies,
New
hot off the
studies.
press. This is
Yes.
great to share with everyone.
You know, the first thing we should clarify is that these studies are conducted on a wide variety of probiotic types, different species of probiotics, these organisms. There's quite a variety of them. Just like there's great variety in our intestinal flora, there's great variety in the types of probiotics. So this is the discussion of the knowledge in total, not any specific ones. First, American Heart Association, double-blind, placebo-controlled, 500 plus adults. This is a highly reliable study, big numbers, double-blind. Adult probiotics lowers systolic blood pressure 3.5 points and diastolic 2.5 points. Those with the highest blood pressure readings found probiotics lowered the blood pressure readings the most. So the more the need, the more the reduction. There's been quite a bit on probiotics and cardiovascular disease. Food Function issued a review of all the available literature on probiotics and cardiovascular disease. Get this, this is really a landmark effort. Review of probiotics, benefit in cardiovascular disease. Probiotics reduce LDL cholesterol, LDL to HDL ratio. It reduces triglycerides, reduces blood pressure, reduces inflammation, reduces blood glucose levels along with body mass and body fat. Now, they did find there is some ambiguity concerning exact strains. Some strains provide this type of benefit, some do not. But in general, probiotics do all of this to help prevent cardiovascular disease. This is profound. This is a review of dozens and dozens of studies. University of Grenada, PLOS ONE, published. This is an animal study. Probiotics reduce fat accumulation in non-alcoholic fatty liver disease. You wouldn't want to set up humans to develop fatty liver disease, so they used animals. The next step would be to find humans with fatty infiltration of the liver, but I'm sure it does because there's been other research that suggested this as well. Probiotics help to get rid of the fat in your liver. You know what else works really well to get rid of the fat in the liver? Taking a walk. It is remarkably effective. So take your probiotic and go take a hike. You're going to get rid of that fat accumulation in your liver. You don't want that stuff in there. It's highly inflammatory to the liver. Next, Cornell, diabetes. Diabetes-induced animals, probiotics help to lower blood glucose levels by up to 30%. You know, we talked about the change in bowel flora induced by diabetes. Taking probiotics gets the conductor back to the enterotypes, you know, the bacteria in the gut, and you process your glucose and your sugars better when you take probiotics, all you diabetics. Next, International Journal of Molecular Science. This is 2016. This, you know, that wasn't that long ago. This is just current stuff right now. Review on diabetes. This is all the available literature on diabetes. Probiotics reduce body mass index, body fat, insulin resistance, blood lipids, inflammation and metabolic stress, while they improve carbohydrate metabolism, insulin sensitivity, and liver function in NAFLD, non-alcoholic fatty liver disease. Review of all the available literature on diabetes and probiotics. Next, University of Maryland, psychiatric research. Those who ate more probiotic-containing foods had lower levels of social anxiety. You know, it's really hard to succeed in the modern world if being in a group of people makes you anxious and makes you want to run for the door. It's really hard. You can imagine trying to, you know, win a job and perform well, working with others and all this. What do most Americans do? They take pills, numb the brain. Don't do that. Reset the bowel neurotransmitters through the use of probiotics. Calm social anxiety. Isn't that amazing? American Society for Microbiology, double-blind, placebo-controlled. Probiotics reduce heavy metal levels in children and pregnant mothers. You know, getting rid of heavy metals can be difficult, especially in children and pregnant mothers due to toxicity. Getting rid of heavy metals can stress the kidneys. Pregnancy is not a time you want to stress the kidneys. Well, use the intestinal tract. Probiotics chelate the heavy metals and pull it out through the intestinal tract and spares the kidney. Isn't this a wonderful concept? It's an effective method to reduce heavy metals in babies, children, and pregnant mothers. Isn't that amazing? Here's one that's very important. We've been waiting several years for this line of research, World Journal of Surgery. A 4-probiotic blend given 1 day before and continued 15 days after colorectal surgery, abdominal surgery. Probiotics reduce post-op complications, reduces the need for mechanical ventilation. You're on a breathing machine. Probiotics help to prevent that. It reduces infections, postoperative infections, and anastomotic leakages. Anastomotic leak. When they cut a tumor out of the colon, they have to hook the ends back together. That's called an anastomosis. You do not want that to leak. That leads to big problems. Probiotics help that to seal up properly and not leak out bacteria that would cause abscesses and infections. Hospital infections, February 2016, a review of 20 trials of abdominal surgery and probiotics. Probiotics reduce post-op surgical site infections and post-op urinary tract infections. And guess what? It did it better than the antibiotics that are currently the standard of care in all surgical procedures in America. Every time you go in for surgery, you get antibiotics. It's not a prolonged course, only 1 or 2 doses during the surgery in hopes of preventing infections. They found from their review that probiotics prevent the infections better than the antibiotics do without the side effects. Isn't that amazing? Let's finish this up before we go. One more new one. University of Maryland, MBio 2015. Probiotic organisms influence the activity of other intestinal bacteria, a facilitator of the overall ecosystem. We alluded to that before. Probiotics conduct the symphony of bacteria. And the last study of our new ones, multi-blend probiotics work better because you have all these diverse actions all in one preparation. Multi-strain probiotics are the best. Now let's go to our break, but when we come back, we want to talk about a summary of the established science on probiotics. We'll be right back. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at BioInnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker Spa Nutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha, Noni, and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let BioInnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
Here is our hope for you today. I'm Cindy Becker. When we struggle with disease and painful health conditions, we can become overwhelmed with negative thoughts. We may even develop depression. The Apostle Paul offered guidelines to help us preserve a positive attitude during times of trouble. He wrote in Philippians 4, verse 8, "Whatever is true, whatever is noble, whatever is right, whatever is admirable, if anything is excellent or praiseworthy, think about such things." Thinking positive thoughts is the first step toward overcoming worry, even depression. Proverbs 17, verse 22 reminds us, "A cheerful heart is good medicine, but a crushed spirit dries up the bones." Remember these words of wisdom as you face your health challenges. I'm Cindy Becker. This is our hope for you today.
Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why BioInnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Again, that number is 888-442-2128. Call today. Ask about the AutoShip program for additional savings.
We're back, everyone, learning about the importance of healthy bacteria in your intestines for good health. This is great information. And I've got to give you another quick reminder. It's fall savings celebration at BioInnovations. Great prices and free shipping on your orders over $50 in the mainland USA. Don't miss it. A great time to get what you need to stay healthy. So, Richard, the new research was really impressive.
Yes.
And I know that you have a summary of established research that's out there that we want to learn about as well.
Well, we're going to go through as many of these as we can as time allows, and maybe your condition will be mentioned, or perhaps someone you love. You'll recognize this. Let's get to it. Probiotics help to reduce death risk in preterm infants who are susceptible to necrotizing enterocolitis. This is a terrible condition. Preterm babies, premature babies, they don't have developed immune systems, and they can get a scenario with bacteria just overwhelm their intestinal tract. If we give these preterm babies probiotics, it reduces that risk of infection with that terrible thing and their death from it. It also helps to prevent candida colonization in preterm infants and helps to get them out of the intensive care unit and onto normal feedings earlier. That is a remarkable development just from probiotics. Probiotics also help to reduce allergic rhinitis and improves overall quality of life and symptoms in adults. It helps to improve immunity and helps people fight off gastroenteritis, and in infants, it helps to reduce rotavirus by as much as 75%. Rotavirus is the #1 cause of infant mortality worldwide. 500,000 babies die every year from this virus. We could reduce that by 75% with the simple administration of probiotics to infants, a matter of routine. C-section babies do not have the colonization of normal delivery babies. They benefit from probiotics. Babies who are not breastfed, who go right to the formula, they need probiotics, and they need representation of lactobacillus and bifidobacterium species. Both lines need to be given to the baby. Now you're up to speed on that. Isn't that interesting? Next, probiotics improve rheumatoid arthritis symptoms. Probiotics improve ICU patients' overall health, and they improve clinical outcomes in intensive care. That's serious business. Probiotic curd reduces plaque formation in cavities in children. A little yogurt does a child good. It helps to prevent cavities. Isn't that neat? It reduces risk of colds in physically active, healthy adults. It reduces colds in students. It reduces colds in industry workers. All those studies have been done and showed that. And the next study showed how probiotics reduce the colds. It improves macrophage production of interferon. The immune system responds, and they've mapped it out. They know how probiotics reduce colds. Reduces the incidence of diarrhea after radiation therapy for cancer. This is a real problem for people. Your life has been saved with radiation and other means to treat the cancer, but you're kind of miserable. Let's be honest. If you take these probiotics before you go into radiation, you're going to have less of this diarrhea after radiation. Probiotics improve the likelihood of sustained remission of diverticular disease. Do you have diverticulitis? You're in pain, agony, you go to the hospital, you want it to stay away and stay diverticulosis. Osis is it's not inflamed, it's just quiet. Itis is it's giving you trouble. Probiotics help to keep it in the uninflamed state. Abdominal pain, diverticular disease. Probiotics, when given to ulcerative colitis, chronic fatigue, or psoriasis patients, lowers inflammation, not just in the gut, but throughout the entire body. This study proved that probiotics has a systemic calming effect on inflammation. That means your arthritis gets better. That means your headaches get better. That means the chronic fatigue gets better, all of it. The fibromyalgia gets better. Anything related to inflammation gets better with probiotics. Multi-species blends of probiotics work the best in IBS. Probiotics improve dry skin. You can increase your vitamin D level about 15 points by simply taking probiotics. Probiotics improve chronic functional constipation in children and adults. Kids that take probiotics are thinner. They have a lower BMI, a smaller waistline, a smaller waist-to-hip ratio. Their triglycerides and LDL levels are lower. This is in children. The seeds of heart disease hit us early. in childhood. We know that without a doubt. Probiotics help to negate that risk. Next, probiotics given after infectious gastroenteritis improve lactose intolerance. You used to could drink milk as an adult, but you had a trip to Mexico or whatever, a little diarrhea there, but after that, no more milk for me. I can't handle it anymore. Probiotics may allow you to go back to drinking milk or other dairy products. Helps to restore lactose tolerance. That's a nice idea. I like that. Probiotics improve the immune status of HIV patients, and they've been able to show how it improves CD4 and T helper cell lymphocyte counts. That's a good thing. Improves mood and stress levels. Improves liver disease associated brain dysfunction symptoms. Psychosis, coma with end-stage liver disease. One dose of probiotics have been known to get a person out of a hepatic or liver coma. That's amazing. Now, it doesn't cure the liver, but it helps to detoxify the system enough that they can come out and they improve. Reduces antibiotic-associated diarrhea, reduces C. difficile risk by up to 65%. This is a huge problem in our seniors today, and even young people today have C. difficile. It even goes down into infants now. We're seeing C. difficile. You can reduce that risk of this terrible antibiotic-associated diarrhea that is life-threatening with probiotics by up to 65% or more. Other things you do even reduce it much more. You won't even need the antibiotics if we're doing all that we can to promote health. I mean, that's the pattern. We can't guarantee you never need an antibiotic. Let's do one more before we go. C-section infants need probiotics. We mentioned that. Organ transplant outcomes. Now, that is a powerful effect on the immune system. We have about 30 more, but we have no time. Are you getting the point? Probiotics improve health, period. Now, let's go to our break. When we return, let's talk about a very special blend of probiotics. You know, we talked about how multi-species probiotic gives the best benefit. Let's explain a little more about that when we return. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at BioInnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker Spa Nutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha, Noni, and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let BioInnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Becker, and this is Your Health at a Glance. Are you one of the millions of Americans who are at risk for heart problems? If your diet is like the average American's, you're getting far more sodium than your body needs, and this may create serious problems for your heart. A new study from the Netherlands showed that a diet high in salt not only increases blood pressure to dangerous levels, it also causes damage to your blood vessels. To avoid these problems, you need to avoid foods that are high in salt, such as preserved and prepared foods like frozen dinners, canned soups and other canned foods, cured meats such as lunch meat, hot dogs, bacon and sausage, condiments and sauces such as soy sauce, teriyaki sauce, and spaghetti sauce, and snack foods such as salted nuts, pretzels, and chips. Eat fresh fruits and vegetables, fresh meats, poultry, fish, and other salt-free alternatives. As you decrease your intake of salt, your desire for salty foods will eventually be reduced. For Your Health at a Glance, I'm Dr. Becker.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastrodefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. Your Health is brought to you by Bioinnovations, trusted products for your health and well-being.
We're back, everyone. Just a quick reminder here about the fall savings celebration at Bioinnovations. Fantastic prices and free shipping on orders over $50 in the mainland USA. I don't want you to miss it. Now, Richard, that's been a great topic today. We've learned so much. So let's put it all together and let's explain to everyone about the multi-strains that we have in Dr. Becker's probiotic with FOS.
So we shouldn't think of probiotics like we think of drugs and drug therapy, where you do a double-blind study with just one species of probiotic. There's a place for that. But all that science has been done, or much of it has been done by the researchers. And the conclusion is take as many different species as is practical at one time. So when we developed our probiotic, I put 8 different species of probiotics in there. Let's name a few. Lactobacillus acidophilus, Bifidobacteria bifidum, L. helveticus, that's L stands for lactobacillus, B. longum, Enterococcus faecium, Lactobacillus plantarum, Rhamnosus, salivarius. You know, this gives us a good variety, 8 different ones at a special ratio to promote good health. Next, we have our chewable probiotic that was designed for children to be able to chew, but also adults can do it too, because not everybody does well swallowing pills. Let's be honest. So I put 7 different bacteria in this, and remember that babies, children, need to have both the Bifidobacterium and Lactobacillus represented in their probiotic species, and then we get the most of the benefits. And I'm really pleased to announce to you that a recent review found that our formula for the probiotics for children, the chewable version, hits the benefits of all the proven benefits for probiotics in children. Because of this diversity of 7 different probiotic strains in the chewable, we get all the benefits that we know occur in children with probiotics. So that is a very good thing. And these 2 special formulas are among our most popular products, and it's for very good reason. You take these, you can tell. Isn't that right?
That's
when
right.
you take them, you go, I feel this one working. This is, and I want you to experience that. Also, don't forget that we should still take our yogurt, our sour cream, our kefir, our cottage cheese, buttermilk, all the fermented dairies. Include that in your diet, add the probiotics, make the changes necessary. This is how you get well. This is how you break the pattern of disease, folks. Science is on your side. Make the change for the better and feel the difference healthy living makes. Thank you for your kind attention. We'll see you, folks. Bye-bye.
Thanks, everyone. We'll see you tomorrow. Bye-bye.
Spectrum Mobile is the fastest growing provider out there. They're growing faster than AT&T, Verizon, and T-Mobile.
Must be using Magic Grow Mix.
What?
Makes things grow faster.
No, they're the fastest growing because thousands of people are switching every day. Because they have the fastest overall speeds and it's the most reliable.
It's probably Magic Grow Mix.
It's not. You can save up to 40% on your monthly bill. Magic Grow Mix isn't even a thing.
It is, I have it, and you might want to stand back.
Join Spectrum Mobile today. Find out why they're the fastest growing provider out there.
I can taste the pineapples already.